So another thing you should notice about the paddle is that it has different surface that you can use for both adult and pediatric. Now this is the adult surface. If you want to switch to pediatric surface, it's very simple. You click down on this button and you slide this side up, so you have access to the pediatric surface. Hey guys, thank you all for sticking around. Welcome back to my channel. In today's episode, we are going to be discussing about the defibrillator. Like I mentioned in my previous video, we are going to be reviewing different equipment in the ambulance, including drugs and procedure. So I made a particular playlist for it and I titled it ALS Ambulance Advantage, which is AAA. So please do me a favor by subscribing to my channel, liking my videos and sharing it with your friends. So in today's video, we are going to be using the following outline, which include definition. We are going to be talking about the types of defibrillator. We are going to be talking about the function and the modes you will see in a defibrillator. We are going to also discuss about the components of a defibrillator. Then lastly, we are going to be talking about the condition and the way you are going to use a defibrillator. Alright, a defibrillator is actually a device that delivers electricity to the heart. Now we basically have four types of defibrillator. We have the external automated external defibrillator, we have the manual defibrillator, we have the implantable cardioverter defibrillator, and we have the wearable cardiac defibrillator. Today's video we are going to focus on the manual defibrillator, and the defibrillator I have here basically have four functions. It has the monitor mode, it has the manual mode, it has pacing mode, and it has AED mode, which is automated external defibrillator. Now the monitor mode will help you monitor patient vital signs and even cardiac activities. The manual mode will help you select energy that you want to use for either cardioversion, which is synchronized cardioversion, or for defibrillation. Now the pacing mode is used when you are dealing with bradycardia. You want to increase the pace in which the heart is beating, so you can select the pacing mode. While the AED mode will help you if you are alone and you want to get as much control over the patient. Is basically the same function with the automated external defibrillator. Different components of a manual defibrillator include your buttons, which is for control. You have this to switch over mode depending on the defibrillator that you are working with. You have analyze, charge, energy level. You have the shock button. Then you have a knob for changing the value of what you want to set. You have for pacing rate and milliamp for electricity level. Now you also have different ports or probe that you can attach to different ports of the defibrillator. You have the SpO2 probe that can be attached here. You have the ECG probe that can be attached here. You have the paddle, which can also be attached here. So this is the paddle. Okay, so this is a paddle. It has similar buttons that you can find in the defibrillator. So you have the shock button, which you have to press simultaneously when delivering a shock. You have the energy to set the energy level that you want to deliver. Then you have the charge. So if you want to charge up before you shock, you have to press this to charge up. So once you have charged it up, then you place this on the sternum and you place this on the apex. So another thing you should notice about the paddle is that it has different surface that you can use for both adult and pediatric. Now this is the adult surface. If you want to switch to pediatric surface, it's very simple. You click down on this button and you slide this side up, so you have access to the pediatric surface. So you can also easily attach it back. So if you don't want to use a paddle, and depending on the mode you want to use something different, you want to use a pad, maybe you set it at automated external defibrillator mode, then you use this pad. So this pad is actually seen in your external defibrillator, your automated external defibrillator. You can also use this pad to deliver pacing. If you want to pace the heart, you want to do external pacing, you can also use this pad to achieve that. So another component, or the last component we have to look at, is the printing component. So it has where you can install strips and where you can print out any values that you want to print out from the defibrillator. Now let's talk about the different mode and some examples that you want to use the different mode. Now let's say you want to monitor your patient. You just turn your knob and you switch to the monitor mode. You connect the different probes to your patient. So the values you can get from the monitoring mode include your SpO2, heart rate, respiratory rate, and ECG. Then if you want to use your manual mode, you can actually use it for two type of conditions. You want to use it with for tachycardia with a pulse and tachycardia without a pulse, like in the case of cardiac arrest. So if it's tachycardia with a pulse, you want to make sure that you do synchronize cardioversion. By how do you want to ensure that? By clicking on the synchronize button. So once you click on the synchronize button, it will start calculating or targeting the arrow wave. So your synchronize button might be different in your own device, so you have to note where the position is. So after that, you have to select the energy level. If you want to select the energy level, you have to click on energy level here. Then you have to rotate the knob to select the level that you want to use. So once you have done that, you click on accept and you charge the defibrillator, then you deliver the shock. The machine duty to deliver the shock at the arrow wave. So that's why it's very important for you to click on the synchronize button. If you have a case of a cardiac arrest reading that is shockable, you need to switch off the synchronize button so you can deliver the shock at any point in the cardiac cycle. So you also need to make sure that you select the appropriate energy level, and afterwards you charge up and you deliver the shock. Then if you want to do pacing, maybe in the case of bradycardia, or you want to increase the rate of the patient, the heart rate of the patient, unstable tachycardia. So what you are going to do is to select the rate. Once you select the rate, you can use the knob to select the appropriate rate that you want to use, then click on accept. Then you also want to select the milliamp of electricity that is to be delivered to the patient. So once you select the appropriate one that you want to use, you press accept, then you start delivering the shock to the patient. So the thing you should take note of, that to know if you are winning, you have to find out two things. You have to find out if you are getting either mechanical caption or electrical caption. For mechanical caption, you start seeing that the patient is responding to the therapy, and in electrical caption, you start seeing a spike, okay, followed by QRS complex from the machine. If you want to use the automated external defibrillator mode, what you just do is that you switch to the mode. It has a metronome which will guide you in the rate in which you use to deliver the CPRO. Is similar thing when you are using the automated external defibrillator. So that's it, guys. Thank you. Precautions you have to take while using your defibrillator include making sure your team member stay clear from the patient when delivering shock, and also making sure that metallic substance and other thing that can conduct electricity to you is not connected to the patient. Okay, so thank you guys for sticking to the end of the video. In our next video, we are going to talk about the 12 lead ECG. Now we have talked about the defibrillator, and I know that you have a lot of questions which you can leave in the comment section below. You can also leave contribution, and you can also leave your thoughts signing the defibrillator. So next time we are going to talk about 12 lead ECG. So I want you guys to stick around, and please do not forget to subscribe and also like our video. Thank you so much. Thanks. Bye.